Hi everyone, this is a video about the herb Pau d'Arco and a condition called Morgellons. Just before jumping into the video, as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So someone posted this question on one of my other videos, basically asking, do I have any thoughts or experience using the herb Pau d'Arco to treat Morgellons? If you don't know what Morgellons is, it's a condition that, as best I can tell from the research literature and what I've seen in clinical practice, where I've treated quite a few cases of it to date, it seems to be caused by Borrelia burgdorferi, i.e. the causal microbe behind Lyme disease. There may be other factors that are involved with Morgellons, could be multifactorial. Just with the limited research evidence on it, it seems to be related to Borrelia, and it can manifest with a wide range of different symptoms, but oftentimes there's a lot of cutaneous, i.e. skin symptoms. So these like fibers coming out of the skin, sometimes there's itchiness associated with it, sometimes there are sores that open up on the skin, and there's just no other explanation for why these things are happening. And then of course there could be fatigue, brain fog, joint pain, all the various things that can come up. And unfortunately, a lot of stereotypically healthcare providers will kind of dismiss it as being more of like a mental health condition, but to my understanding, from what I've seen, again, in clinical practice and from research literature, does not seem to be a mental health condition. It's just an under-recognized, sort of very strange infectious manifestation. So with that backdrop out of the way, Pau d'Arco, it's a wonderful herb. I've used it many times, but I've really only used it for gastrointestinal concerns. So folks dealing with small intestine bacterial overgrowth, that's usually when I use Pau d'Arco. So I think it has great antimicrobial properties for the gut, but I really don't know how well it works for systemic concerns. I'm not really sure how well it's absorbed into the body, like into the bloodstream. So on the one hand, when the person posted the question, it's like, well, I could have just said, I don't have experience with this, I'll leave it there, but I did want to create this video anyways, because it gives me an excuse to talk about Morgellons. I feel like it's just an under-recognized condition, underappreciated condition, and for folks who have Morgellons, I think it's just probably at least somewhat encouraging to hear some people talking about it as not a mental health condition. With Morgellons, what I have found to be the most effective approach is to work with the same types of systemic antimicrobials, potentially biofilm disruptors, alongside of those, as I would use to treat, Lyme co-infections and things like that. So herbs I've talked about in other videos like Cryptolepis and Alcornia, Chinese skullcap, Japanese knotweed, things like that. I've also found that the patients with Morgellons that I've treated who have been able to access IV therapy, intravenous ozone therapy has been helpful in the majority of those patients. And like any type of chronic health issue, especially when it stems from a chronic infection, we want to be thinking about supporting the mitochondria, healing up the damage that's occurred, that's been caused by the infectious microbe or the immune system sort of inflammatory activation that can occur by those microbes, and help address that. Finally, I think I've only seen it in maybe 1 or 2 cases, but sometimes low-dose immunotherapy can be really helpful in Morgellons as well. So just a little reminder about our good friend LDI therapy, where sometimes if the main issue is the immune system activation, then using the killing herbs or other antimicrobial treatments might only be partially helpful or sometimes not helpful at all. But then immunomodulating with a really great immunomodulating tool like low-dose immunotherapy can be really helpful. And if you have not heard of low-dose immunotherapy or you want to know more, please feel free to check my back catalog of videos. I've had several videos that I posted about it, including quite a lengthy video, I think it's about 45 minutes long, that I posted years and years ago, which is a rendition of a presentation I gave at one of Dr. Dietrich Klinghart's Lyme disease conferences years ago in New Jersey. So I posted a YouTube recording of my dialogue from that presentation. So if you really want to go down the rabbit hole, go back to the very first videos that I posted on my YouTube channel, Halifax Naturopathic Doctor, and there's a lengthy description there about low-dose immunotherapy and how it applies to Lyme and co-infections and whatnot. So thank you for the question. I hope that answered your question, gave you some useful information. If anybody has any questions or comments about this topic or anything else, please just post in the comment section below, and I'll do my best to answer as soon as I can.